Hello, and thank you for joining this interactive telephone town hall about COVID-19 and Santa Clara County. My name is Dirk, and I will be moderating today's call. We'll hear from your federal representatives, as well as Dr. Sarah Cody, the Santa Clara County Health Officer. Now, as I mentioned, this event is an interactive forum, and we would love to answer your questions about this developing situation. We'll be taking as many questions as we possibly can live during this event. If you have a question, you can press *3 on your telephone keypad, and you'll be placed in line to speak with a staff member. They will take down your name and where you're calling from. The next time you hear your name, you will be live on the call and able to ask your question directly. Again, if you have a question you want to ask at any time during the call, please press *3 on your keypad to enter the question queue. Now, I'll get things started by introducing Representative Zoe Lofgren, who represents California's 19th Congressional District. Congresswoman, the floor is yours.
Thank you very much, Dirk, and thanks to everyone who's on this call. This is a telephone town hall about COVID-19 in Santa Clara County, and we have every member of Congress who represents Santa Clara County on this call, myself, Eshoo, Khanna, and Jimmy Panetta. We have been working together these last weeks, not only for our county, but also with our leadership in Congress to address issues that are so important in this national emergency. We've never gone through anything like this before in the last century, and the stress and strain on our families, on our health system, on each of us as individuals is unprecedented. We are doing everything that we can to make sure that people get the support they need through the health system, that our institutions such as local government and hospitals and public health get the resources that they need, that individuals and businesses get the financial support that they need to survive. We are very interested in hearing your comments and your questions this afternoon, and I'll note that there are over 2,000 people on this call right now. At the end of the meeting, if you have not had your question asked, there'll be an opportunity to leave your question or comment, and you will be heard. So with that, I would like to turn next to my wonderful colleague in Congress, Representative Anna Eshoo, for her remarks.
Thank you, Zoe, very much for your special and extraordinary leadership on so many fronts. And I want to welcome everyone to our town hall meeting. I want to acknowledge the work of all of our healthcare professionals in Santa Clara County, our first responders, all the groups and the nonprofits, everyone pulling together to take good care of people during this time of enormous challenges and the crisis of this virus. We just completed a call with the Speaker of the House and our colleagues, and let me just summarize it in this way. We all know that April 1st is fast approaching. People have to pay their mortgage or their rent. They have to pay their student loans. They have to make their car payments. Small businesses are closed now, and their employees have absolutely no place to go for income. And so what we are working on 24/7, and God willing, we will have a consensus bill in the Congress shortly that will address the needs of our healthcare professionals, our hospitals, our local communities, families, and workers. This is not about the very top. This is about extraordinary, ordinary people across our country that are struggling to keep the tent up. So I'm prepared to take your questions, and I thank everyone that has called in for your patience, for your goodness during this time of crisis. We need to do this together, and together we're going to come through it. I now will yield to my colleague, friend and next-door neighbor in terms of our congressional districts, Congressman Khanna.
Thank you, Congresswoman Eshoo, and thank you to you and Congresswoman Lofgren for your extraordinary leadership, and to Congressman Panetta, who we will be hearing from. It's been terrific that we've been able to really work as a team, and I want to thank and echo what Congresswoman Eshoo said. I mean, the real heroes are the medical personnel, the people who are still going to doctors' offices, to hospitals, not just the nurses and the doctors, but administrative assistants, the attendants. They are taking a risk of their own safety, their own well-being to treat others. And I just want to say how appreciative I am, and so many people in our community are, for their work, and we really applaud your courage. I also think that there are many people working on trying to get more protective gear, more masks, to N95 masks to our healthcare community. One of the challenges has been as I understand it, that hospitals are not able to prepay for these masks that are coming from other parts of the country. I know many technology leaders have been working to try to provide some of the capital up front so that can happen, and then we've all been pushing that our federal government should be actually funding these hospitals to do that. The final point I want to make is how proud I am of how Santa Clara County and frankly the Bay Area has handled this. We were one of the first places in the entire country to shelter in place. I think they should have had a shelter in place for the entire country weeks ago when we did this as a Bay Area. I believe that because of the decision our local leaders have made and the county's made, and all of our citizens trying to comply with this, that we're going to be able to bend the curve in our communities and really have been ahead of a lot of other places in how we've addressed this. So I'm really proud of our local leadership in what we were able to do. I now want to turn it over to my colleague and someone who has been working diligently on helping address this issue, Congressman Jimmy Panetta.
Hey, Ro. Thank you. Thank you, Representative Khanna, and of course, thank you, Representative Lofgren, for organizing this, and then, of course, the leadership shown by Representative Eshoo on these public health issues. We really appreciate this opportunity and having this chance not only to talk to each other. That's not what this call is about. This call is about listening to the people who are calling in so that we can continue to get more information from you, but also at the same time respond to you as best as we can. As Ro alluded to, this really, the strategy that we've been sort of employing in this is a locally executed, state-mandated, federally funded type of strategy when it comes to dealing with this bruising pandemic that all of us are being affected by. And so from our part, I think what you're going to hear from today is, at least from the federal representatives, is the discussions about what we have done at the federal level to continue providing the amount of funding that's necessary to deal with the public health issues, to deal with the unemployment insurance issues, to deal with the SBA issues, and of course, from my point of view, continuing to bolster supplemental nutrition assistance program and the agricultural issues, be it that I represent the Central Coast of California, just south of the South Bay, and I have part of Santa Clara County and Gilroy. But on that note, we also know that it's about what the experts have to say, and so it's an honor for me to introduce to you someone who is on this call, who I believe all of us look forward to listening to, and that's Dr. Sarah Cody. Dr. Sarah Cody serves both as the health officer and director for public health department there at Santa Clara County. She's got 450 staff she has to deal with. She's in charge of 30 programs. She's got more than a 20-year career in the public health department, and she now leads the organization in providing services, assessing and reporting community health, and working on policy and strategic planning. And she's leading us through this pandemic as we go forward. And there's a reason why Representatives Lofgren and Eshoo and Khanna praised her, is that because she's doing a hell of a job and taking the lead on this as she has to. And so it's my honor to introduce to you Dr. Cody. Thank you, Dr. Cody.
Thank you so much, and thank you for inviting me to be on the call. I don't usually get to work directly with my federal representatives, so this is a true honor. What I would like to do is just give you a flavor for what it's been like on the ground here in Santa Clara County, give you a sense for how this unfolded, provide you with a situational update for what we know right now today in our county, and discuss what we think it means and the approach that we've been taking. So first I want to, this is absolutely unprecedented. And never in my career did I imagine that I would be involved and responding to a pandemic like we are experiencing right now. And I think that it really shows the importance of public health and what we do in public health. But it's certainly, while it started out as a public health event, and I can tell you that in late January, in our department, we stood up a small operations center and a conference room in our disease prevention and control program, and that's where it started. But now it's not only a whole of government approach, it's the whole of the community, and we need every single person living in the community to do their part to slow the spread of disease. It's absolutely important, and every single person has a role to play. And the work of thousands and hundreds of thousands of people is happening and is very much needed. So our statistics to date, as of 5 o'clock yesterday, we have confirmed 375 persons with COVID-19. That's 375 people living in Santa Clara County, and 16 deaths. That's 3 more than we reported the day before. The cases that we're reporting are still, they represent the most severe. A number of our cases are hospitalized or in the ICU. That mostly reflects who we're testing. So we still know and we still acknowledge that what we're seeing probably are what we call iceberg tips. It's the tip, we're able to ascertain and identify the tips of the icebergs, but they probably represent a large number of infections that are not detected, either because people have very mild symptoms or people have less mild symptoms but aren't able to get tested because the testing capacity is still limited. And I can touch on that later just a little bit. Santa Clara County, as you may know, was an early hotspot in this pandemic in the United States. And as of now, we represent, our county represents about 22% of the cases statewide and almost 60% of the deaths in California. We were also the county where we had, early on, I remember we had our first 2 cases. They were travel associated quite early. We were just trailing Washington State. And we also had a higher percentage of the nation's PUIs, or people under investigation. So that was an early indicator to us that we were going to be that we were going to be a hot spot, and that we needed to lean in and act fast. So right now, the real key is we absolutely have to slow down the spread of disease. So we know that everyone in the population, by and large, is susceptible. None of us have ever seen this infection before. Nobody has immunity. So we are all at risk of becoming infected if exposed. We are most concerned about certain groups, people who are older or people who have chronic medical conditions. When people in those groups become infected, they have a higher probability of needing to be hospitalized and having severe illness. And as you get older, you have a higher probability of not surviving the infection. So it's really critical, and many of our actions are designed around trying to protect the most vulnerable groups. and trying to slow down the spread of infection so that when people do get sick and need care in a hospital or in an ICU bed, that we have that bed ready and staffed. I just want to say that here in the county of Santa Clara, I feel I was asked by a reporter sort of, what am I frustrated about? And what I said was, my overriding emotion actually has not been frustration. My overriding emotion has been gratitude. And I have never, ever experienced anything like this of our government partners, both within the county and external to the county, as well as our community partners and our healthcare delivery system partners, working so extraordinarily well together in unprecedented and extraordinarily difficult times. I would also say that the relationships and the partnerships among the local public health officers around the Bay Area have been critical and have enabled us to act in a unified manner to protect the greater public around the Bay Area. The major bodies of work that are going on right now, of course, we have an entire team that's working to ensure that our healthcare delivery system is ready, that we know where the surge within each hospital and how we can use and stand up external resources to offload the hospital needed. We have a whole nother body of work to ensure that people who don't have housing get housing and are protected, and many, many, many other bodies of work that are going on, and everything is moving incredibly, incredibly fast. I think that I guess I'll just two things. The shelter-in-place order that we put into place in Santa Clara County, as well as the 6 other jurisdictions around the Bay Area, we believe we're having good compliance. We believe that it is slowing the infection. I do want to highlight, though, that because our data are imperfect, it's a challenge to understand the impact, to see immediately the impact of the measures that we're putting into place. But we have a number of partners working with us to help us understand that. I also wanted to just note around laboratory testing, which has also been an extraordinary challenge, and it's not scaled to the extent that we need it to, that the Bay Area, the same Bay Area health officers just issued an order this morning that requires laboratories who are testing people who live in our counties to report to us not just people who are positive, but people who test negative. And that's going to give us a much better sense for how widespread is our testing in our county. And it also can tell us what proportion of people testing are positive. And then we can identify if there are areas in our communities where there seems to be a greater degree of spread of the virus, then we can take action. So I think I will stop there and just want to thank you again for the opportunity to join you, and I'm happy to answer any questions that I can.
Thank you very much, Dr. Cody, for those opening remarks and your insights. As a reminder to everyone on the call, this is a live interactive telephone town hall, and we're about to get to questions. If you're in the queue to ask a question, we'll be coming to you hopefully very soon. But if you're trying to get in the queue by pressing *3, then I must ask for your patience. We have a lot of people are trying to ask questions, so we're working just as quickly as possible to get as many people on this call as possible. So we're going to take our first caller. We've got Vicki in San Jose, and Dr. Cody, this one will come to you. Vicki, you've got a question about mail in the newspaper. Go ahead with your question, please.
Yes, I guess what I'm trying to find, I know that it's like 24 hours on cardboard boxes and I think 4 hours on copper and 2 days for plastic and stainless steel. But what about when you go out and get your mail and bring it in and the newspaper? I mean, are those things something I should like put in the garage for 24 hours? Can they be opened right away? I don't know.
Yeah, there are so many questions coming up, and what I would say is a very, very basic tenet that you can stick to that's going to help for anything is this. After you touch anything, if you have to go out to perform something essential like get your groceries and return home, or if you pick up your mail, always wash your hands after touching anything and before you touch your face or touch anything else. It just involves a lot of hand washing.
Very good. We move next. We've got Bonnie and Gilroy. Congresswoman Lofgren, stand by for this question. Bonnie, go ahead with your question, please.
Thank you. This isn't exactly a medical question. This has more to do with the current bills in Congress regarding funding for small businesses and workers and unemployment and so on. Because I'm retired and living on Social Security, my self-interest, of course, revolves around that. And I wonder if there are any provisions similar to what Senator Warren has suggested, the additional $200 a month or some figure like that are in the bill. I mean, I know the money comes from the House and not the Senate, so I was just wondering if anything like that was included.
Well, the bill right now, there's a Senate bill that is not as expansive towards small business and individuals as we think is appropriate. The House has a bill, and we just got off a 2-hour conference call with Speaker Pelosi and the chairs of the various committees that has more expansive benefits for small businesses as well as individuals. It would allow small businesses not only to get SBA loans, but also there are grants available for small businesses. It would allow sole proprietors who do not have employees to also be eligible for the SBA program, but also unemployment insurance. We have provisions to make sure that contractors, for example, at the airport, who are not employees of airlines are also included in the benefit package as well as the paid leave package. These, for example, airport cleaners, I mean, they're going in to clean airplanes from China without even protective equipment. We need to make sure that people who are self-employed and also working under contractors have the support that they need. Now, having said that, there's an argument going on right now. Speaker Pelosi is in the middle of negotiating with Senator McConnell and the Republicans in the Senate to try and have the most expansive plan possible that benefits individuals, regular people, working people as possible. And we won't know the outcome of that probably until later today or even later this week. I saw in one of the news screens that there was squabbling over the bill. It's not squabbling. It's really a clash of who are you going to value most? Big corporations who bought back stock and now want relief for that, or the employees who are having to meet their day-to-day payments, their mortgage payments, their food payments without a paycheck. And that's what we're trying to orient it towards. Thanks very much.
And Zoe, if I may, this is Jimmy Panetta. Also, in regards to, in what I saw in the Speaker's bill, feel free to correct me if I'm wrong, as my colleagues always do, thankfully. I know with the direct cash assistance, there right now in the Speaker's bill, there's $1,500, 1500, of immediate assistance per individual or child, and that means up to $7,500 for a family of 5. And there's going to be certain income limitations on that we're going to put in place right now in the Speaker's bill. It's $150,000 for joint filer, $112.5 for head of the household filer, and $75,000 for a single filer. That's going to be the qualifications for that direct assistance payment. But exactly like Representative Lofgren said, there are things still to be worked out and negotiated, which thankfully Speaker Pelosi is doing.
Thank you very much, Congressman. Next up, we've got Leslie, and this is a health question, how doctors can keep their families safe after they're seeing people. Leslie, go ahead with your question, please.
Yes, I'm concerned because, my aunt is in a skilled nursing facility and they are quarantined, of course. However, I do have to attend some appointments with her because she'll be having surgery for her cancer. So that's coming up, and my mother is elderly and is vulnerable, and she's diabetic. So I want to make sure that I'm taking the right precautions, and I don't know if, since I'm going into the hospital, if I will, infect her somehow, or if I shouldn't visit her because she's alone, of course. So I just want to make sure I'm doing the right thing.
But you go to Dr. Cody, yeah.
Yes. This is an extraordinarily difficult kind of situation because, of course, we all need at times to access care, whether it be for COVID-19 or not for COVID-19. What I would do in your situation, of course, is before you bring a family member in for care, that you call ahead. Many hospitals are changing, adapting and changing their policies. Sometimes there's a different entrance for different types of care. So absolutely call ahead. Some hospitals, it sort of depends, or some outpatient settings will see whether, for example, a visit could be conducted remotely rather than in person, also to reduce the risk. So I guess my top line message is call ahead and find out, because the less that you or your family members are interacting with others, the more protected you'll be.
Thank you very much, Doctor. Next, we've got John in San Jose. A question about the relief package for airlines. Go ahead, John. You're live on the call.
Hi, thank you. Thank you for taking my question. I'm a member of labor in the airline industry. One of the conditions for the airline portion of the relief package that has been talked about is limiting airlines from doing stock buybacks, which I am for. I believe managements do this to prop up their stock for executives' benefit. However, an unintended consequence is that airlines may at some point accumulate cash for a rainy day and then become a target of a corporate rate or leverage buyout. Frank Lorenzo did this at Eastern Airlines decades ago. Al Checky at Northwest Airlines did this. Carl Icahn at TWA. And they left these companies, they took all the cash and left the companies bankrupt for the labor members to have to deal with. Therefore, I'd recommend in the legislation, if they can put some sort of poison pill in there to prevent this, and I would recommend something like allowing labor unions a veto vote on a leverage buyout like that, or if it's not unionized, somehow allowing workers a vote to prevent this. In order to prevent them from just being a corporate, being a leverage buyout target. So I was wondering if I could get your comment on that, and whether the legislation that they're putting forward right now, or the bill, includes something like that. And then I have a quick question about the medical side. Can you get the virus through a break in the skin, like a cut or something like psoriasis or eczema on the skin? Can the virus enter that way? Thank you very much.
Thank you, John. Representative Eshoo, would you like to take the airline portion of the question?
Well, what I can say broadly about the House bill is that no monies will go to corporations for CEO pay, for stock buybacks. Our bill is based on workers. The Speaker said during our 2-hour conference call this morning, she went through many sectors, including working with organized labor. So our bill is very solid on protecting workers first. Now, what everyone has to keep in mind is we have a democratically controlled House, a Republican president, and a Senate that is controlled by Republicans. That's not a partisan take. That's simply the composition of the Congress. And so what I think the House bill is the strongest, broadest bill for the American people, but we have to work through each one of these issues line by line, subject matter by subject matter. So we are all hoping that the provisions that would apply to the question that you just asked are actually retained and not taken out by the administration or by the Senate. It's really, in many cases, 2 against 1. So keep that in mind, but our bill speaks directly to the questioner's, what the questioner posed.
Anna, can I just pipe in addition to
Sure.
what you have said, in the bill, the aid to the airlines is conditional not only on the no buybacks and no CEA raises, but also on the retention of employees and contractors, and there's also a prohibition on entering bankruptcy after a successful recovery to then discharge obligations to employees. The question raised by the caller about cash accumulation is for a different day. Right now the airlines are going under financially. There's no revenue coming in whatsoever. But the point he's making is something we need to think about. This is bill number 3. There will be additional measures in the coming weeks and months. So his issue has been well noted, and thank you. It's not, unfortunately, going to be anything that happens soon, but it's something to think about down the line. I think Dr. Cody's the one who needs to answer about the cut in the skin.
Yes, I'm happy to answer that. So this SARS-CoV-2, the virus that causes COVID-19, it's a respiratory virus. So it's primarily spread by respiratory droplets when someone is speaking, coughing, or sneezing, mostly by those larger droplets, but probably to some extent by smaller aerosols as well. I'm not aware of any evidence that it could spread through a cut in the skin. The primary, what we call portal of entry, or the way it goes into your body, would be through breathing it in or through one of your mucous membranes like your eyes, nose, or mouth.
Thank you very much, Dr. Cody. Next up, we've got Daniel, who I think is a question that will probably come your direction, so please listen closely. Daniel, go ahead with your question, please. Daniel, are you with us? Hello?
Is it me? Hello? Can
Yes.
you hear me?
Please go ahead with your question.
Okay. My name is actually Samuel, calling from San Jose. So my question is, so we've heard a lot in the news of the president and his plan, and I'm thinking he potentially a week from now or a little later can say it's time to go back to work, open the schools, and return to normal. And we all want to get back, the sense of normalcy, but not at the expense of public health. In the case that the president says, okay, let's get back to work in school before it's time, before the science tells us it's time, what is our plan?
This is Dr. Cody. I feel very strongly that we need to continue these broad mitigation measures and social distancing until such time as we either have other more precise tools to slow down the spread, or until such time as there's enough of the population that is immune from natural infection. And we simply don't have that information to say that it would be that we could start to peel back on what we're doing. We know from experience looking around the world that what we're doing now with these broad measures is necessary, and it will save lives. We understand that it is an enormous hardship, both for people personally, for the economy, for their businesses, and we hope that there's ways to somehow mitigate that. But these measures are necessary to save lives, and they're going to need to be in place for a bit of time.
Thank you very much, Doctor. Next up, we've got Scott in San Jose, and wants to talk about taking walks or what to do while under a shelter in place. Go ahead, Scott, with your question, please.
Sure. Thanks so much for all of your leadership on this. We do appreciate it. To be in spirit with, I think, the stay in place, stay at home, is it okay for those of us to go out for these walks? I think we've all seen the coverage for the beaches, of course, but we've also heard this weekend with the trailheads kind of hitting record attendance numbers. What is your guidance here for how this virus spreads and what we know for us going outside?
Thank
Dr.
you for
Cody?
the question. This is Dr. Cody again. The core principle is the following. To the extent possible, you don't want mixing. So to the extent that you're just with your same stable household group while you're at home, that it's as small as possible and as stable as possible. That helps prevent mixing from one group to the other. And so that's what our shelter-in-place order does, and that people should only go out to perform or receive essential services. That's sort of the bottom line. However, we also know that we can't all stay inside all the time, and we need to go outside. So it is okay to go outside, go on a walk, take your animal for a walk, or go out on a walk with a household member. However, while out, you still have to maintain that social distance of at least 6 feet from someone that's not part of your usual core little group. And so what that means is groups of people gathering outside, for example, to go on a hike or to go to the beach, that is not maintaining social distance, and that does pose a risk for the virus to spread. So the key take home is, yes, you can be outside. Yes, you can be outside with people of your stable household group. But if you are outside with people who aren't from your stable household group, you need to maintain at least 6 feet. And smaller, more space is better, and smaller group is better.
Thank you very much, Dr. Cody. Next up, we've got Betsy, Representative Eshoo. I believe this question can come towards you. So, Betsy, go ahead with your question, please.
Yeah, Betsy Bryant from Saratoga. I have a question. Since so many Americans are losing their employer insurance, is it possible to open up the the Affordable Care Act? I'm not going to go ACA. Affordable Care Act to individuals throughout the United States, since we're going into critical health care, and it could be soaring, and this virus would lead to very serious situations where people would go to the emergency room instead of going to calling their doctor because they do not have insurance.
Well, it's an excellent question, and I thank you for calling in. We have many parts of this bill that deal with exactly what you're talking about, an expansion of Medicaid, which is really the foundation of the Affordable Care Act, but it also expands on it. Enrollment in the Affordable Care Act has been extended. Now I think to July. It was to June 30th, but you could go online and check with that. But we also have provisions. Now this is in the House bill that there will be more dollars for people not only to be tested for free, but that they have backup medical care should they need it. Because if they are uninsured and contract the virus, you have to take care of people beyond a positive test. We have all of that in the House bill, Betsy, and I just pray that these portions, these really critically important portions of our health priorities in the House bill are included in the bill that's presented for a vote, not only for the Senate but the House. So thank you for your question.
Thank you very much, Congresswoman. Next up on the line, we've got Sherry with the Defense Production Act on her mind. Go ahead, Sherry, with your question, please.
Oh, hi. This is Directed at Congress team. This is Sherry Guzell from Los Gatos. And I just wanted to know what we as constituents can do to help press the action of the Defense Production Act, which is really the only way that I can see that we can scale quickly in terms of getting the PPE that's needed to the front line of healthcare providers.
Thank you, Sherry, for your question. And if we can send that to Representative Khanna, please.
Sherry, thank you for your question. There's no doubt that we need the invocation of the Defense Production Act to have ventilators made, to have N95 masks made. And the reality is that the president is conflating the issue when he says, oh, I don't want to nationalize industry. He doesn't need to nationalize industry. He can just say that the federal government is going to pay certain companies to have ventilators and going to pay certain companies to produce masks. The idea that we could rely on voluntary compliance for this or voluntary initiatives is just not going to be sufficient. It requires extraordinary resources for a company to be producing ventilators. And while they may do some based on a voluntary good community spirit, the reality is that they need that investment. And he's signed the Defense Production Act, but so far he's not saying that he's going to fund it or tell companies to do it. And it's a huge missed opportunity because if we were to do it, I'm confident we'd be able to get the ventilators that our state needs or states like New York need.
I would just, Congresswoman Eshoo, I would just add to the excellent summary that Khanna just gave. Simply put, ventilators, for example, cost something like $25,000. No company can go out into full production and produce 100,000 or 250,000 of them without any guarantee of being paid. It simply doesn't work that way. But when they know that they're going to be fully reimbursed, that they start manufacturing and manufacture 24 hours a day, then that would bring up the supply in our country. Why the president isn't doing that, none of us can explain it to you, but that's the way it works on the private side. The federal government contract, you will be paid.
I would just add, we're lucky that both Jimmy Panetta and Khanna serve on the Armed Services Committee and are in a position to press on this. But I would urge citizens to also call in to the White House and urge the president to act. It's inexplicable that he would sign the Defense Production Act and then fail to utilize it to actually get the goods produced. So we need public pressure on the president to do that.
Thank you very much, Congresswoman. Next, we've got Bob on the line. Bob's in San Jose. And matter of fact, Congresswoman Lofgren, this one's probably a good one for you to listen and answer. Bob, go ahead with your comment.
Hi, this is Bob from San Jose. And I just got back from Morocco, and I barely got out of there. And I believe so is Lofgren's staff did help me out, so thank you very much. But one of the things I was getting concerned about was towards the end of the trip, I was getting a lot of harassment, racist harassment from people just calling me Corona and confronting me. And then I came back to the States, and I'm hearing that there's a lot of that going on too, and people getting beaten up. So I want to know if anything is going to be done to address that, and how you might go about it.
Well, thank you for that question, and I'm glad we were able to help get you out of Morocco. My staff and the staffs of all the other Congress members on the phone are working overtime trying to get people, Americans who are stranded overseas, back home. Sometimes we're succeeding and sometimes we're still working on it. On the issue of the stupidity of targeting our Asian American fellow citizens for this virus, I think we do have hate crime laws in California, and I know our district attorney is looking at that as an opportunity, but really there are two things I would urge. One, that each of us in our individual capacities speak out and make it completely unacceptable for people to turn on each other when this is a virus. The virus doesn't have an ethnicity. This is a virus that threatens everyone. And that we might also ask those, including political leaders, who are calling this the Chinese virus or the Wuhan virus, to just stop it. Stop it. That is encouraging people to divide along ethnic lines. It's the last thing we need in this country right now. We need to pull together, to work together to get through this time. And I hope that those political leaders who engage in that rhetoric will be called to task for it by not just other political leaders, but by everyday citizens.
Thank you very much, Congresswoman. Next up, we've got Nancy from Willow Glen. And Dr. Cody, this is a good question for you. Go ahead, Nancy, with your question.
Hi, this is Nancy from Willow Glen, and I am so happy that you're doing this conference call. It's very helpful to all of us, and I also appreciate the leadership that California is taking in protecting its citizens. My question has to do, I'm a senior and sheltering in place with my husband, and I have a sewing machine. I have seen posts relative to making masks out of fabric, and I'm wondering, first of all, if this is really something that people in the health industry can use, and if so, where do I send them? Thank you.
Thank you, Nancy, for that question, and I am very glad to hear that you are safely sheltering in your home. The honest answer is I have heard a bit about people making masks. I don't think that they could be used in the healthcare sector where there are particular standards for personal protective equipment. Whether they could be used elsewhere and provide some protection, the honest answer is I don't know. So I would, in Santa Clara County, I could see if I could get that question forwarded to the right person to help vet it and get information back to you. It's a little chaotic with so many lines of questions coming in, but we'll do our best. But again, the honest answer is I don't know.
Dr. Cody, if you can get that answer, each of us members of Congress can post the answer on our website to get the information out.
I'll do so. Thank you.
All right, our next question, we've got David on the line, and David, he's got a question that anyone here on the call could answer, any of the representatives. Go ahead with your question, sir.
Hello, I guess this is me, David Westerman.
Yes, sir.
Oh,
yes.
Okay, yes. I guess it's directed to anyone, but Zoe Lofgren is my representative. And my concern is that there's been a lot of political football that's been played by the Democrats, adding things like emission requirements for airplanes, limiting ice, and a lot of other things that are totally unrelated to this virus thing. I'd like to know why the Democrats are adding a lot of extra stuff in addition to the needed aid to businesses in their House bill.
Well, I'd be happy to answer that. I think a lot of what you've heard about what is supposedly being added to the bill is being suggested by people who oppose what we're doing. For example, I heard yesterday that the Democrats had put the Green New Deal into the bill. That's just not correct. I will say also that there are some things that might not seem like they're related to the COVID emergency, but that are. One of the things that I worked on was a vote by mail provision so that we can preserve our democracy. As you, I'm sure, have seen, a number of states have postponed, and there's a threat that they could cancel elections. We cannot allow American elections to be eliminated. And we have a provision in the bill that requires, during the COVID-19 emergency, that registered voters be mailed ballots so that the elections can go forward. We do not want the November elections canceled, that would be a catastrophe for the American democracy, and it's something many of us feel very strongly about. ICE and the Border Patrol have come in asking for huge amounts of money, and we have asked for what? There are a number of steps that have been taken by USCIS in the face of the emergency. For example, all the civil courts have closed or postponed non-essential matters. The immigration courts have taken the same step. They don't want crowded people in the courtrooms for out-of-custody matters. And so we have questioned the dollar amounts, not just for those matters, but for everything that's in there to make sure that what's being spent is thoughtfully spent. So I think overall it's a good package on the House side. We probably won't get everything that's in it through the Senate, but it's a good, solid emergency package.
So this is Ro. If I could just make one point. When there was the financial crash in 2008, and of course Representative Lofgren and Representative Eshoo were in the Congress, it's important to remember that there was not a single Republican who was willing to vote for President Obama's stimulus bill. In fact, the president wanted more. It was about $750 billion at the time. He wanted $1.5 trillion, and the Republicans blocked it at every step of the way, and not a single Republican stepped up to work across the aisle on that. In fact, McConnell said that he was rooting for President Obama's failure because he wanted Obama to only have a single term. In contrast, the Speaker of the House and Representative Lofgren and Eshoo and Democrats have actually pushed for a larger stimulus to get more relief to people and to help our economy, putting aside any politics or partisanship than even the Trump administration wanted. So I think it's really important to realize the total difference in approach that the Democrats have taken than the Republicans have in this issue.
And this is Congresswoman Eshoo to the caller. Everything that is in the House bill is COVID-19 related. You may be getting information from other sources, but I think everyone has to really be on their toes in terms of reading, absorbing information.
Thank you very much, Congresswoman. Next up, we've got Andrew on the line, and Congressman Panetta, you want to listen to this question? Andrew, go ahead, please.
Yes, my request is Congress consider pass a law to allow tax-free and penalty-free withdrawal from 401k, all the 401ks, or at least 50% of the 401ks. Here is the reason. There are many Americans who have had good income. My two daughters, as example, they are in their late 20s, and they are on the jeopardy of losing their job because they are in the travel and entertainment industry business end of things. And they have their only asset is 401k. They are going to get laid off, and they are going to be basically have no asset to bridge the gap until they can find their next job. Now, also, if you put a threshold of 70,000, 80,000, the good news is that last year they had an income of over that threshold. They're single, but this year they're going to have an income of all of a sudden from $100,000 a year to zero, and who knows how long it's going to be until the travel and consulting business coming back. So my request is pass a provision to allow tax-free and penalty-free withdrawal from all the 401ks without any income limitation. That will inject a great deal of money into the economy, and that will also allow a critical middle class or lower middle class to be able to survive this downturn. Thank you.
Thank you very much.
Thank you. I got it. Dirk, I'll answer it as simply as I can. I think in regards to the House bill that Speaker Pelosi is negotiating right now, our bill waives all penalties for early withdrawals when it comes to 401k. So I think, we have taken that into account in going forward, and hopefully the Senate does too. And correct me if I'm wrong from the other members.
You're right, Jimmy, and I would note also that there is a provision right now. If you're over 72, you are required to take a a minimum distribution every year, and that under our bill would also be eliminated because the IRAs have been crashed with the market, and so that there is a waiver of the required minimum distribution rule under the COVID emergency as well in our bill.
Thank you, Congresswoman. We've got another caller question. We've got Tony in Mountain View. Tony, you're asking about symptoms, so I think, Doctor, you'll probably want to listen to this.
Yeah, this is Tony from Mountain View, and the question has to do with the messaging from the president and through the governors and now with the Congress down to the counties and in some cases mayors and cities and then even municipalities at marinas and airports. And really, the question is, we see the signs on the freeway to beat the COVID virus, but I don't see anybody talking about the symptoms and the time course and what you should do if you have the virus. Should you know, who to contact or how to get tested? I know this is developing, but I think that should be more of the discussion. The finances is also an important issue, but I see beat the virus, but I don't see anything about the symptoms and the time course.
Thank you for the questions. The symptoms of this virus can range from having no symptoms at all to having symptoms like cough, fever, shortness of breath. The key thing to know is that anyone who's having any type of respiratory symptoms, and it could be cold-like symptoms, flu-like symptoms that we all recognize, should isolate at home and away from other people to keep from spreading. That's the number one important message. If you have any respiratory symptoms, stay at home. If your symptoms progress, then you should call your healthcare provider and arrange for care, and it's important to call in advance so that they know that you might be infectious.
Thank you very much, Dr. Cody. Next up, we've got Frank on the line, and Frank is thinking about mortgage payments. Go ahead, Frank.
Hey there.
Question.
Yeah, thank you. So I heard in Italy that the government suspended mortgage payments, which seems like a thing that would be really wouldn't cost any money at all. It would just delay payments if mortgages were delayed for some period of time. This seems like a reasonable thing to do that wouldn't really affect anybody other than positively.
Congresswoman Lofgren, would you like to answer that?
That is something that Maxine Waters, chair of the Financial Services Committee, put a package of measures together, including that one. So that is something that is being thought about right now with the Senate, and we're hopeful that that we succeed in that. The last thing we want, on top of the loss of income, on top of the illness, and in some cases death, is to have a kind of financial housing disaster similar to what we had in 2008. So I'm hopeful that we will prevail in that. I would note we had planned on this call going about an hour. I don't know how long Dr. Cody can stay on. We had over 7,000 people on the call, and there are several hundred people waiting to ask questions. We're obviously not going to get those questions answered on the call, although we will get them all at the end of the call. But Dr. Cody, how long can you stay on?
Unfortunately, I'm going to need to step away from the call. I have something else I need to get to, so I'm only able to stay on till 2. I'm trying to think if there's questions that come that are health questions, whether they could be packaged up and I could find a way to get the answers back out to you all.
We have one more question for you, and then we'll excuse you, and then maybe we can stay on, the other members can, for a few more minutes for non-Cody questions, and we'll get them to her.
Thank you.
Okay, Congresswoman, thank you. Our next question is for Dr. Cody. Reshma in Saratoga, go ahead with your question, please.
Yes, hi, this is Reshma from Saratoga. Can you hear me?
Yes, I can.
Hi, I'm actually calling. I had two questions, but I'm going to go ahead and ask my second question first. I have two kids that are graduates of medical school, and they've done their experiences, but they're going through their licensing exams. And I wanted to know how can they be of help in terms of emergencies when there is an overload for healthcare professionals. And I hear that retirees are being called in, and they're in that that age group that is more susceptible to the diseases. My second question was, I'm part of the Saratoga CERT team, which is the City Emergency Rescue Team, and we've been trained to be prepared for such emergencies, but so far there's no activation or no information for how we could be of help. So these are my two questions. How can
Thank
we
you
be
all. Yes,
anybody
I'll try to take your questions in two parts. The part of the healthcare surge planning group is looking at staffing. There's sort of three parts to healthcare surge planning: facilities, equipment, and staffing. And they're trying to work to understand where they can best use people, both licensed, unlicensed, and in the process of becoming licensed. I think that's still an area of uncertainty, so I don't have a clear answer as to how your children might be able to fit in. Related, the question of many volunteers with different types of skill sets, that's also another body of work within our Emergency Operations Center in conjunction with cities to see how can we best deploy all of the people who have volunteered to help. So it might be easiest probably to work through the city that you live in rather through the county. And each city emergency operations center is connected with a county emergency operations center. And thanks so much for the invitation to the call and for the questions. And I'm going to unfortunately need to drop off.
Doctor, thank you very much for your time and insights on this call today. It's been very, very informative.
You're most welcome.
So next, we've got Kevin in San Jose. Kevin, your question, please.
I guess it's a two-part question. I'm currently a contractor for a nonprofit university, and my one question is, in these bills, are nonprofit universities going to be supported because they're just financially harmed as well as public universities? And my second one is, as a contractor, I understand in California that I cannot collect unemployment. Will that be something they'll look into waiving for this, just for this period?
Who wants to take this?
If we were still playing basketball, I would say it's a jump ball. So any representative like to take that question?
Well, I'll say that the nonprofits are included in this package, at least on the House side. We're having, again, negotiations with the Senate that did not cover nonprofits, as well as contractors being able to access unemployment benefits. That is in the House package as well. And again, still negotiating with the Senate.
And this is Anna Eshoo. In addition to that, both of the questions that you asked are would be allowed under the House bill under the SBA, the Small Business Administration, to qualify for loan forgiveness if, in fact, the organization maintains their employees. And of course, we're doing everything in the House bill so that employees are retained. So I hope that's helpful to you.
Thank you very much, Congresswoman. Next on the line, we've got Victor, and Victor has a question about detention center people. Victor, go ahead with your question, please.
Hi, I'm just curious if anything's being done about our immigrant community in detention centers and our low-risk inmates that are highly susceptible to infection.
Well, I'll talk about the immigrant detention centers. We have, in addition to what's in the bill, we have been urging the administration to take steps to reduce the risk of transmission in vulnerable spots. And one of those is the civil detention centers for people in immigration systems. We have urged that individuals who are in civil detention who do not pose a threat in terms of criminal law measures, which is 99%, be released on an ankle bracelet or some other provision that would require their attendance at their later immigration hearing, so that we do not have transmission of the disease in those facilities. We have not yet received that commitment, but it is something we are urging the administration to do. They don't need any additional laws to do that. As to the release of inmates, low-risk inmates by counties, that is something each county has to do, and I understand that Santa Clara County is reviewing that right now and doing what they can.
And I can tell you, being married to a judge who's in charge of the criminal courts down here in Monterey County, they are doing exactly that. They're obviously having meetings, but that type of decision for the county jails are going to be at the county level with obviously input by those in the criminal justice community, judges, public defender, as well as district attorney, and of course the sheriff.
Thank you very much, Congressman. Next on the line, we've got Richard, and he's thinking about, let's see here, Richard, you're thinking about homeowners possibly facing evictions. Go ahead with your question, please.
Yeah, hi. First of all, I want to thank the Democratic leadership for all they're doing. And, I know that a lot of people like myself are facing tough times with this coronavirus. And I was wondering if there could be some kind of bill set in place where, the mortgage companies would be able or be willing or forcibly have to put people into loan modifications, at a 2% interest rate, just so that people could obtain their houses and also have family members live there instead of putting kids and family members out on the streets. What are you guys doing about that? I heard earlier that you guys said Maxine Water has some kind of bill going already.
No, let me just clarify that. Division 1 of the bill, Section 108, is mortgage forbearance. She was the proponent. I just wanted to give her credit since she chairs the Financial Services Committee. The provision prohibits foreclosures and repossessions for the duration of the pandemic and 180 days thereafter, and it requires mortgage forbearance for homeowners for up to a year, including a prohibition on fees and additional interest during the term of the forbearance, as well as loan repayment options at the end of the forbearance. That is in the House bill. It's not in the Senate bill. It's something we're fighting for.
Can I add something to this too? So I just put out a letter to the 3 county tax collectors that are part of my congressional district for property taxes. And the second payment for property taxes is due April 10th. Each county has put out, I would say, rather vague statements on this. They can't change the state law, and the state legislature is not due to go back in after April 10th. Each county tax collector to do is the following: to allow people to make a series of payments and not add any penalties to what would be considered late payments. And I think that would go a long way for, in this case, homeowners that are facing the same crisis that we all are. And I hope that we will post as soon as we get answers back from them on our websites that we have one policy in San Mateo, Santa Clara, and Santa Cruz counties on this. I think it would be enormously helpful to homeowners to have peace of mind on this issue.
Okay, I think we've got time for 2 more questions. If our moderator would get those questions.
Yes, ma'am. We've got Ken next on the line. Ken from San Jose. And Representative Khanna, please listen to this question. Ken, go right ahead, please.
Okay, I'm concerned about many small businesses, nonprofits, and fraternal organizations in terms of time relief, because it will take time to regroup after the epidemic. And I'm just wondering, in terms of time, space, just the time for repayment and relief for some of these organizations, since they've already been struggling before the epidemic.
And I appreciate that. And in fact, on our conference call with the speaker on 2 hours, a lot of the conversation was precisely about how we're going to help small businesses, how we're going to help some of the independent contractors who are out there, people who do home health work, who are drivers, who maybe aren't employees, and how we're going to help nonprofits. And there are several things that we've been pushing for. The final details of the bill are still to be determined, but we've been saying that the loans and the assistance has to be to small businesses, has to be to nonprofits. It has to include independent contractors so that they can benefit as well. Second, I think after the stimulus, we need to really push for a moratorium on mortgages, foreclosures, or evictions with rent. I mean, when you have restaurants that have had to basically shut down or just do takeout, you can't expect that they're going to be able to meet their commercial rent. So I agree with you that this is going to take a long time for some of the small businesses and nonprofits to recover, and that's top of the mind of House Democrats as we're fighting for the appropriate relief and assistance.
And just to let the caller know, in the current bill that the speaker has put forward, it obviously, on top of everything we did in the first 2 tranches, this third tranche will, in addition, it will continue to streamline, obviously, for small business, provide more than $500 billion with a B in grants and interest-free loans, and there will be some forgivable components, as we talked about today. And also going forward, $100 billion, once again, B, $100 billion for COVID-19 related SBA economic injury grants, and $184 billion, another billion in SBA low-interest disaster loans. So trust me, I think all of the four of us on this phone line have heard from our constituents how important it is to shore up the SBA and continue having these bridge loans for those, here, especially, for me on the Central Coast with all my hospitality industry who are really taking a hit right now. This is very important, something that we'll continue to be concerned with going forward.
Thank you very much, Congressman. And our final question that we have time for today is Cynthia. And Cynthia, you've got a COBRA question. And so Representative Eshoo, please listen to this question and be ready to answer.
My name is Cynthia from San Jose, and thank you so much for taking my call. I know you have so many people to fit into this important conversation. So my husband was laid off 1 year ago, and I'm concerned that right now it's kind of difficult to set up interviews, obviously, and it seems that maybe hiring is going to be in a slowdown phase. So we're concerned about this ticking clock that our COBRA coverage is going to run out before my husband or I can find a full-time job with benefits.
Representative
And your question is, yes, to COBRA, because I don't know, Cynthia, and maybe one of the other members would recall something in the House bill that I'm not recalling. It's a gigantic bill. But what we have built into the House bill are very important health provisions for people. And it includes those that are that are unemployed so that they do have coverage, certainly testing for everyone, and subsequent health care if they are tested positive. So we want people to not only be made whole in terms of their income from the jobs that they're losing due to the virus, but also the cascading issues relative to our economy. In your case, you described it, that they will have health care coverage. So stay tuned, because once this bill is, the big bill is agreed to and passed by both the House and the Senate and signed into law by the President, we will have the most solid information for you. We don't know if all of these important health provisions that are in the House bill are going to survive, but we're fighting damn hard to make sure that they are, so that you, Cynthia,
I would just add, Anna, in addition to what you've said and the fight that you've made as chair of the Health Subcommittee in Energy and Commerce, Title III under the private insurance provision, Section 307 in the House bill, provides subsidy to allow workers to maintain employer-sponsored coverage for COBRA if they're subject to temporary furlough. I don't know if that would help this questioner, but we will do further research and post the answer if there's additional information on COBRA on our websites. With that, with our moderator, I want to thank you, moderator, for the good job that you've done, and our staff for helping to get us all on this phone call. I want to thank Congresswoman Eshoo, Congressman Khanna, Congressman Panetta, and I also want to thank Dr. Cody for being on this call. We are out of time, but we're not out of questions. So if you will, at the end of this call, and you have a question or a comment, stay on the line, and there will be instructions on how to leave your question or comment, and we will do our very best to get you answers. I just want you to know that the four of us, and indeed hundreds of members of Congress, are working as hard as we can to ameliorate the impact of this pandemic disaster on our country and on each of you. We are on constant conference calls, shaping the legislation, supporting Speaker Pelosi, fighting for the American people, and we appreciate your participation in this call, and at this point we will thank everyone for their participation and sign off unless other members would like to make a closing comment. If not, okay, we will close. Okay. Thank you.
We certainly will. Thank you very much, Congresswoman, and definitely a big thanks to all the congressional members, as well as Dr. Cody with the Santa Clara County Health Office, for participating on today's call. I'd also like to thank you, everyone listening in our community who joined. We appreciate the opportunity to answer your questions, but if we were not able to get to your question, you will be able to leave a voicemail for your member of Congress. If you decide to leave a message, please include your full address as well as your email address so your question can be best answered. You can also contact your member's office at the following numbers. For Representative Lofgren, 408-271-8700. For Representative Eshoo, 650-323-2984. Representative Khanna's office, 408-436-2720. And Representative Panetta's office, 831-429-1976. We will host more of these events in the future to keep you informed on what Congress is working on, as well as available resources and other important updates on the coronavirus. Thank you again for participating in this call. We hope you stay healthy and safe and have a wonderful day.